Assalamu alaikum wa rahmatullah, and welcome to our third lecture in the course of head and neck. So let us get started. Our agenda for today will, in this lecture, will cover or will have like an overview of the neck anatomy, and we'll also study the neck fascia because it is a little bit unique than other fascia in the body. We'll also have a closer look into the neck triangles. We have two triangles, and most of our session will focus on studying the anterior triangle of the neck. So let us, in the beginning, define what is the neck itself. So as you see here, the neck is part of our body that lies between the head on the top and the shoulders. Okay, so between here and here, this is the neck, and as you see, it is covered by the skin from all sides. It has superior border and inferior border, anterior and as well as posterior. So as you see here, anteriorly, the above borders or superior borders of the neck includes the mandible and the mastoid process in the back here. Okay, but lower down here you can see the suprasternal notch and the clavicles on both sides. Okay, in the back, the upper boundary of the neck, we'll see the nuchal lines, superior and inferior nuchal lines, and lower down, we'll see like imaginary line connecting the acromion process and the 7 cervical vertebra. So this line from here and here, this is the lower boundary of the neck. Um, uh, this picture showing a cross section of the neck. So let us study this cross section from outside to inside or from superficial to deep. So as you see here, the most outer layer, this is skin. This is a skin that's around the neck from outside. Okay. When we go deep to beneath the skin, we will see this red sheet of flat muscle. This muscle is called platysma muscle, and it is unique because it is found in the superficial fascia. Okay, and it is also originating from a fascia, from the pectoral fascia, and inserted into the lower border of the mandible. So it has origin from a fascia, not a bone, not like the other muscles that we study in the upper and lower limbs. Most of them originate and inserted into bones. But here, this muscle originates from a fascia, but inserted in a bone. It's called the platysmal muscle, and it is innervated by the facial nerve. It assists in opening of the mouth and depressing the mouth. Okay, so it is found in the superficial fascia. Other structures found also in the superficial fascia are these two veins. We have the external jugular vein, which is here, it's called external jugular vein, and these two veins here, which are called anterior jugular vein. So let us start describing the external jugular vein. External jugular veins are two veins found in the superficial fascia of the neck, and it is made by confluence of two smaller veins. We have the retromandibular vein, which is here, and the posterior auricular vein. So posterior auricular vein together with auriculomandibular vein, they will form the external jugular vein, which extend downward, crossing this muscle, and this muscle is very important. We'll talk about it in minutes. This muscle is called sternocleidomastoid muscle. So both veins cross the sternocleidomastoid muscle from medial to lateral, and they drain downward here in the subclavian veins. We have also, as I said, two anterior jugular veins. These are important when we do like tracheostomy operation or even thyroidectomy. We need to take care of these two veins. Okay, let us go deeper. So we said that this is a skin, superficial fascia, including the platysmal muscle. Deep to it, we'll see the deep neck fascia. And this deep fascia um, uh, is organized into several distinct layers. Okay, so the first of them, which is here with the blue color, we call it investing layer. And as you see, investing layer, it surrounds the neck like a collar from all sides. And when it comes here, it will split to include or enclose this muscle, which is sternocleidomastoid muscle. When we go here to the back, it will also split to enclose the trapezius muscle. Okay, so this is the investing layer of deep cervical fascia, which is the first distinct part of the deep fascia. We also have the pretracheal fascia, which is found here, and this pretracheal fascia surrounds the trachea, esophagus, and the thyroid gland, and it extends downward until it reaches the level of aortic arch in the thorax. Okay, we also have this layer, which is the prevertebral fascia, and the prevertebral fascia surrounds the cervical vertebra together with paravertebral muscles. We have group of muscles surrounding the vertebra, lie anteriorly, laterally, and posteriorly. All of them are surrounded by this prevertebral fascia. And the last part of the deep cervical fascia is the carotid sheath. Here and here, we have two carotid sheaths, and this carotid sheath actually surrounds the internal jugular vein together with the common jugular vein, sorry, internal and common carotid arteries, internal jugular vein, and the vagus nerve, these structures, neurovascular structures. Common and internal carotid artery, internal jugular vein, and vagus nerve. The three are surrounded by loose aerial connective tissue forming part of the deep cervical fascia, and this fascia is called carotid sheath. Okay, you see here, this is other view or other picture showing also the deep cervical fascia, okay, of the neck. And as we said, it encloses the neck like a collar from all sides, and it is split to enclose the sternocleidomastoid muscle, trapezius in the back. It also encloses to surround the parotid gland and submandibular gland. So this is called an investing layer of deep cervical fascia, which is the outermost layer of the three or four deep fascia of the neck. This deep fascia of the neck, when it encloses these different structures, it forms like three or four compartments. Okay, we have the first compartment, which is called visceral compartment, which is here, and it also called anterior compartment because it contains viscera like trachea, esophagus, and thyroid glands. Okay, it is called visceral compartment. We have also vertebral compartment, which is here, and this compartment is posterior and contains the cervical vertebrae and the spinal cord inside the vertebrae and the cervical nerves and muscles that associated with the vertebral column. Okay, uh, the third and fourth actually compartments are two vascular compartments, and these compartments, one on each side, are lateral and contain major blood vessels, which are, as I said, common carotid artery, internal carotid artery, internal jugular vein, and the vagus nerve. Okay, so these are called compartments of the neck. Okay, let us have a look to the neck triangles, and as you see here, we have actually two big neck triangles. Okay, this part here is called anterior neck triangle, and this part here is called posterior neck triangle. And as you see, it is very clear that this muscle, which is called sternocleidomastoid muscle, a very important landmark muscle found in the neck. It plays a major role in dividing the neck triangles anatomically, just to help us study these two triangles. Okay, So this landmark, which is sternocleidomastoid muscle, help in dividing the neck triangles into anterior neck triangle and posterior neck triangle. Okay. So what are the boundaries of the anterior neck triangle? The anterior neck triangle is bounded by sternocleidomastoid muscles laterally and in the midline, anteriorly, the midline, imaginary midline, okay, in the mid of the neck, and superior as you see here, the lower border of the mandible and a smaller muscle here called digastric muscle. Okay, so this is the superior boundary of the anterior triangle. This is the posterior boundary of anterior triangle, and this is the anterior and inferior boundary of anterior triangle, which is the midline. So between the midline, mandible, and sternocleidomastoid, this part is called anterior triangle. And as we'll see in minutes, it will be divided also into other smaller subtriangles by a group of muscles here, supra and infrahyoid group of muscles that will assist in dividing this triangle into further subtriangles to help us to study the structures in the neck. In the back here, this is a posterior neck triangle, and it is bounded between the sternocleidomastoid muscle, the middle third of the clavicle, and the trapezius uh, muscle in the back. Okay, so this triangle bounded by these two muscles and the clavicle bone, clavicle bone. Sorry. To understand these structures well, for sure we need to have an idea about this muscle. So from its name, sternocleidomastoid, we can easily figure out the size of attachment of this muscle. So sterno, it has a head that originates from the sternum, okay, sternal head, and it has clavicular head, which is attached to the medial third of the clavicle, okay. So sternal head, clavicular head, both heads, they extend up to be inserted into the mastoid bone of the temporal bone, mastoid muscle of temporal bone, okay. So it is called sternocleidomastoid muscle. These are the two heads of origin for this muscle. This muscle is innervated by the accessory nerve, and the accessory nerve, this is the 11th nerve, it supply both the sternocleidomastoid muscle and trapezius muscles. Okay, you'll see it in minutes as well. And its action, it moves the head laterally. It assists in the lateral movement of the neck. As I said, this is the sternocleidomastoid muscle, and this is the trapezius muscle. So here, this is the imaginary line in the middle, and this is the mandible above, and the sternocleidomastoid. So this is the site of uh, anterior neck triangle. In the back here, between trapezius, sternocleidomastoid, and clavicle, this is the posterior neck triangle. As I said, this triangle and also the posterior one is further divided into other smaller triangles by presence of other smaller muscles. So here, regarding anterior triangle, this is called submental triangle, and this triangle number 2 is called submandibular triangle, and or digastric triangle. It has two names. And here number 3, this is called carotid triangle, and number 4 here, this is called muscular triangle. So all these are sub-triangles in the anterior neck triangle. Also, to understand the neck triangles better, we need to know the muscles that share in the formation of the anterior neck, anterior part and posterior part of the neck. So we need to study these muscles. Most of these muscles, or all of them, attach to the hyoid bone. So what is hyoid bone? Hyoid bone is C-shaped bone, which is found just hanging in the neck anteriorly above the larynx. Okay, it has greater horn and lesser horn, and body of hyoid bone. So greater horn of hyoid bone, lesser horn of hyoid bone, and the body of hyoid bone. Okay, we'll see it in a minute. Okay, so to understand the anatomy of the neck well, we need to study, as I said, the muscles in the neck, especially the anterior triangle. We have two groups of muscles. We have suprahyoid, and from the name, it is very clear that these muscles are found above the hyoid bone. And we also have infrahyoid muscles, and that group of muscles found deep and beneath and below the hyoid bone. So let us study suprahyoid muscles, and as you see here in this picture, we have anterior belly of digastric and posterior belly of digastric. These are two muscles suprahyoid muscles. We have mylohyoid muscle, which is also here. Okay, we have the geniohyoid muscle, which is here. So geniohyoid, anterior belly of digastric, mylohyoid, three. Okay, and uh, we have also stylohyoid muscle, which is originating from the styloid process and extending down to the hyoid bone. So four suprahyoid muscles: geniohyoid, anterior bit of digastric and posterior bit of digastric, mylohyoid, and stylohyoid. So four muscles, and their names indicate their attachment. So, for example, stylohyoid, that means it originates from the styloid process, which is here, and inserted into the hyoid bone, stylohyoid. And this muscle is innervated by the facial nerve. All of the suprahyoid muscles functions, they elevate the hyoid bone. They elevate the hyoid bone, and we need to elevate the hyoid bone, especially during swallowing, okay, during eating and deglutition. We have digastric muscle. It has two bellies, anterior belly, which is originated from the mandible, from digastric notch, and it is inserted here in this belly called digastric belly, which is attached to the hyoid bone, and it also has posterior belly, which is here, the posterior belly of digastric, originating from the medial part of the mastoid process. So it will also insert into this tendon, which is also attached to the hyoid bone. So it has anterior belly, posterior belly, both of them attached to the hyoid bone. The third muscle, which is mylohyoid, and this is a broad muscle that share in the formation of the floor of the mouth, attached to the mylohyoid line, which is found throughout the mandible here, and inserted into the hyoid bone. So it forms part of the floor of the mouth. The posterior bit of digastric and the stylohyoid process, both are supplied by the facial nerve. Okay, the anterior bit of digastric and mylohyoid, both are supplied by mandibular division of trigeminal nerve. Mandibular division of trigeminal nerve. This is motor nerve supply. The last muscle is called geniohyoid. Geniohyoid. It is also another muscle which lies deeper to the mylohyoid muscle and originates from the genial tubercle, which is found here in the mandible, and inserted into the hyoid bone. This is the muscle here. Okay, so geniohyoid muscle. So these are the four muscles. The geniohyoid muscle is innervated by C1 cervical vertebra, the first cervical branch of the cervical plexus supply this muscle. So here in the back, facial nerve, here uh, mandibular division of trigeminal nerve, and the geniohyoid from C1. And I want also to draw your attention to this nerve, which is the facial nerve. And if you remember, when we talk about the foramina, we said that we have stylomastoid foramen. So this is styloid process and this is mastoid process. Between them, there is a foramen called stylomastoid foramen. Through this foramen exit the facial nerve, the seventh cranial nerve, and as you see here, it gives muscular branch to supply the posterior bit of the digastric and the stylohyoid, sorry, muscle. Okay. Regarding the infrahyoid group of muscles, these are also four muscles, and also you can easily figure out their attachment from their names. We have sternohyoid. This is the outermost one, and it is very clear that it originates from the sternum and inserted into the hyoid bone. Okay, this long muscle, we call them also strap muscles. Okay, sterno, from its name, sternum hyoid. The other one is divided into two. It lies beneath this muscle. It has two sections, sternothyroid, and as it is clear that it attached to the sternum and the thyroid bone or cartilage, sorry, which is one of the main cartilages that form the larynx, sternothyroid, and its extension is called thyrohyoid. Thyrohyoid, which is also attached to the thyroid oblique line of the thyroid cartilage and attached to the hyoid bone. Okay, so sternothyroid and thyrohyoid. The fourth and last muscle, which is called omohyoid, and this is a very important muscle. It originates from the scapula, okay, in the back, and it has a belly, which is found here, and it extends other fleshy part, which extend up and inserted into the hyoid bone. So it forms a belly here, and originated from the scapula and inserted into the hyoid bone. It is a very important muscle called omohyoid bone. Omohyoid bone. So sternohyoid, omohyoid, thyrohyoid, and sternothyroid. Okay, all these muscles, the four of them, are supplied by the cervical plexus, nerve plexus, mainly from the nerves or roots C1 to C3. And this exact nerve that supplies these muscles is called ansa cervicalis, as you see here. We have cervical nerve plexus originated from C1 to C5. Okay, so C1 to 3, they form one nerve, and they go downward here to supply the infrahyoid muscles. Okay, now let us focus to study the anterior triangle of the neck. Okay, anterior triangle of the neck, as we described earlier, lie between the sternocleidomastoid muscle, midline, and the mandible. It is further divided into other four subtriangles. So anterior here between the two bellies of digastric, anterior belly of digastric muscle, and the hyoid bone, we have this small triangle here is called submental triangle. Submental triangle. The other triangle, which is found between the anterior belly of digastric, posterior belly of digastric, and mandible above, which is here, this triangle is called submandibular triangle. Submandibular triangle. The third triangle, which is found between the posterior belly of digastric and stylohyoid muscle and the anterior belly of omohyoid and the sternocleidomastoid muscle itself. This triangle, which is found here, is called carotid triangle. Carotid triangle. And the last and the fourth subtriangle, which is found here between the anterior belly of the superior belly of omohyoid and the sternocleidomastoid and the midline, which is found here. This triangle is called muscular triangle. So we have four subtriangles in the anterior neck triangle. Uh, for each triangle, we need to know the boundaries of the triangle, the roof and the floor that form the triangle, and the contents that are found inside this triangle. So let us start by the submental triangle. As I said, uh, the boundaries of the submental triangle are the it has a floor, Okay, the floor is formed by the mylohyoid muscle, which is deeper here, mylohyoid muscle, and hypoglossus muscle. We will see it when we come to the mouse. Okay, so these two muscles, they form the floor of the mouse and the roof of this triangle. Okay, uh, this triangle lie between the anterior bit of digastric and the midline. So anterior bit of digastric laterally, midline medially, and the hyoid bone here. Uh, the three form this small triangle, which is called submental triangle. As I said, its roof uh, or floor uh, is the mylohyoid and hypoglossus muscles, and its roof, the investing layer of deep cervical fascia. The investing layer of deep cervical fascia uh, forms of the, the roof of the triangle. Okay, the contents of this triangle, we have just lymph nodes. Okay, smaller lymph nodes. We call them submental lymph node that drain the tip of the tongue and as well the anterior part of the maxilla and okay, the anterior part of the maxilla and the tip of the tongue. It also contains the anterior jugular vein. You see it in the previous slides. So these are the contents: three submental lymph nodes uh, and anterior jugular vein. Okay, and lymph nodes, anterior jugular vein. Okay. Yes, these are the contents. There is no another content. Okay. The other triangle, which is digastric or submandibular triangle, which is found here, and as you know that its boundaries, we have the anterior bit of digastric, and then we have the posterior bit of digastric, and we have the mandible on the top. Okay, so these are the boundaries of this triangle. The floor is made also of mylohyoid and hyoglossus muscle. These two muscles that form the floor of the mouse. They also form the floor of this triangle, and the roof is also made by the investing layer of deep cervical fascia. The contents of this triangle, as you'll see here, we have the submandibular salivary gland, which is this one, very important salivary gland. It secretes mixed saliva, or mixed type of saliva, um, mucus, and cirrus. You have also submandibular lymph nodes, as you see here. This is lymph node, this is lymph node. We call them submandibular lymph nodes. And we also have facial vessels. This is a facial artery. It leave or a branch of the external carotid artery. It goes deep beneath the submandibular gland. That's why we don't see it on the top here, but we see it when it emerges from the gland. So this is called facial artery. And the facial nerve goes above the gland, so you can see it here. Okay. So the contents of the digastric or submandibular triangle, submandibular salivary glands, submandibular lymph nodes, facial artery, and facial vein. Okay. I want also you to see this nerve, which is the hypoglossal nerve. The hypoglossal nerve, this is the cranial nerve number 12. Cranial nerve number 12, and it enters the submandibular triangle and it goes to supply the tongue. It supply the muscles of the tongue. Okay, supply all the muscles of the tongue called hypoglossal nerve. The third triangle, which is called carotid triangle, and as you see here, this triangle lie between the superior belly of omohyoid, which is this one, this muscle, and the sternocleidomastoid muscle and the posterior belly of digastric. So here this is the posterior belly of digastric muscle. This is the sternocleidomastoid muscle, and this is the superior belly of omohyoid. So here this is the site of the jugular, carotid triangle. Okay. It has also a roof and floor. The floor again the thyroid and hyoglossus muscles. Okay, and the roof is investing layer of deep cervical fascia. This carotid triangle has contents. These are the contents. As you see here, this is a common carotid artery, and then it will divide into external and internal carotid arteries. The internal carotid artery will leave the triangle, but the external carotid artery, you can see it here. Okay, so this is the common carotid and internal carotid artery. Okay, we also have the internal jugular vein, which is here, and in the back and between them we have the vagus nerve. We have the vagus nerve. Okay, up here in the top you can see the lower or the cranial nerves, cranial nerve number 9, glossopharyngeal, 10, vagus, and accessory. This is accessory, and this is a glossopharyngeal. Okay, glossopharyngeal, accessory, and the vagus nerve. These three nerves leave the skull from the brain through the jugular foramen. That is why, because this is now the internal jugular. So together with the internal jugular, all of them they leave the skull through the jugular foramen. So we'll see them in minutes and we'll try to describe them as part of the anterior neck triangle. Uh, one of the important structures that included in the carotid triangle are the common carotid artery and external carotid artery and internal carotid artery. Okay, so the common carotid artery, as you see here, branch from the arch of aorta at the level of or opposite C6 vertebra. It will divide into external carotid artery and internal carotid artery. Internal carotid artery will extend in the neck without giving any branch. It has no any branch in the neck. It will continue to get inside the skull to supply the brain. It is one of the main sources of blood supply for the brain. But the external carotid artery has like 6 branches, 3 anterior and 3 posterior, and then it has 2 terminal branches. So as you see here, this is like enlargement in the base of the external and internal carotid artery. We call them carotid sinus. Okay, this carotid sinus, as you know, they contain receptors, stretch receptors, to detect the blood pressure. If there is high blood pressure or low blood pressure, they can detect any change in the blood pressure and tell the brain about these changes. Okay, so they are found here in the carotid sinus. So let us study the branches of the external carotid artery. As you see here, the first one, which leave the artery anteriorly and descend to supply the thyroid gland. This artery is called superior thyroid artery. The other branch, which is here, it also leave the artery anteriorly and it goes to supply the tongue. Is called lingual artery. Lingual artery. The third one, which is found here on the top, is called facial artery, and if you remember, we describe it because it goes beneath the submandibular gland. It goes to enter the submandibular triangle, and then it leaves the gland anteriorly to supply the face. Okay, it will go up here and supply the face. So these are the 3 anterior branches. But the posterior branches, we have this one, the first one, which is called ascending pharyngeal artery that supply the pharynx. And then up here we have the occipital artery, which supply the occipital region of the head. And more severely here, we'll have the posterior auricular artery. So ascending pharyngeal, occipital, and uh, posterior auricular artery, which supply the area behind the auricle or ears. Then this is external carotid artery. It will divide into its terminal two branches, which are maxillary artery, and we see it when we study the infratemporal fossa. So many branches that leave this artery, and all of them are very important. And we have also the superficial temporal, okay, superficial temporal artery. So these are the final or terminal divisions of the external carotid artery. Regarding the internal jugular vein, it leaves the skull or the brain through the jugular foramen, and it descends downward in the carotid sheath. Okay, it's surrounded together with these vessels by the carotid sheath, and at the end with it join together with the subclavian vein, they form the brachiocephalic vein. So internal jugular vein with subclavian vein, they form the brachiocephalic veins. The last and important structure which is found in the carotid triangle, which is the vagus nerve, okay, which is here. This is the vagus nerve, and the word vagus, as you know, it means wandering, because it is the longest cranial nerve. It originates from the skull and supply all the structures in the neck. It has branches in the thorax. It has branches in the abdomen up to the intestine, up to large intestine. So uh, it is very long cranial nerve. That's why it's called vagus nerve or wonderful nerve. So it leaves the skull through the jugular foramen together with the internal jugular vein. And as I said, it lies in the between the internal and common carotid artery and internal jugular vein. It lies between them in the back. Okay. It has several branches. Okay, it has several branches. Branches that supply the pharynx, we call them pharyngeal branches. And branches that supply the larynx. Okay, external and internal laryngeal branch that supply the larynx. And it also has a carotid sinus branch that carries the impulse or the information from the baroreceptors, which are found in the carotid sinus. And before it gets to the thorax, it also gives a cardiac branch that supplies the heart. Okay. We can also see other nerve, which is the glossopharyngeal nerve, which is this. This is the ninth cranial nerve. As I said, 9, 10, and 11. The three leave the skull through internal jugular foramen, and it passes anteriorly to reach the base of the tongue. Okay, it has lots of branches. We'll see them later on. The third uh, nerve, cranial nerve, that also leave the jugular foramen, which is the accessory nerve. And the accessory nerve, after emerging from the foramen, it descends a little bit and goes backward. Okay, it goes backward to supply the sternocleidomastoid muscle and trapezius muscle. Okay, let us describe the fourth and the last triangle, which is the muscular triangle. And as you see here, it has boundaries. The boundaries made by the superior belly of omohyoid, superiorly and laterally, and then the sternocleidomastoid muscle, which form the lateral and inferior boundary, and the midline here uh, form the medial boundary. Okay, it also has a floor, which is made of sternohyoid and sternothyroid muscles, these muscles, and it contains parts of the larynx and it contains also the thyroid gland and lymph nodes. All of these structures are found in the muscular triangle, which is the fourth and last triangle. We need also to know something about thyroid gland. This gland here is called thyroid gland, and this thyroid gland has two loops, right loop, left loop, connected with a small portion called isthmus. Okay, mainly lie in front of the larynx and upper part of the trachea. Okay, and as you know, it is one of the endocrine glands that secretes very important hormone T3 and T4, which are very vital for metabolism for the life. Attached to this gland posteriorly, we have other smaller four glands, two on each side. These smaller four glands are called parathyroid glands. Parathyroid glands, and also these are very important glands that secretes parathyroid hormone, which is important in controlling. It plays a role in controlling and regulating the calcium metabolism in the body. Uh, This gland is supplied, the thyroid gland, by superior thyroid artery coming from the external carotid, from middle thyroid artery and inferior thyroid artery. Okay, it the venous drainage of the gland goes through superior thyroid vein, middle thyroid vein, and inferior thyroid veins. Okay, the superior and middle thyroid veins drain into the internal jugular vein, and the inferior thyroid vein drain into the brachiocephalic veins. Okay, you can also see here, this is the vagus nerve. When the vagus nerve descends in the neck, it gives a branch called recurrent laryngeal nerve. The right recurrent laryngeal nerve hooks around the subclavian artery. Okay, and this nerve ascends in the back, as you see here. After hooking around the subclavian artery, it ascends up to supply a part of muscles of the muscles of the larynx. Okay, the muscles of the larynx, and the left vagus nerves gives its recurrent laryngeal nerve that hooks around the arch of aorta, and it ascends up also to go and supply the larynx, the muscles of the larynx. Okay, so we have right and left recurrent laryngeal nerves, and as you see, these nerves, both the recurrent laryngeal nerves, they have closer relationship with the inferior thyroid artery, which is coming also from the subclavian artery. Okay, so they have closer relationship with inferior thyroid artery. So this relationship is very important because during the surgery, because thyroid gland can have a long list of diseases like hyperthyroidism, Hashimoto disease, tumors, whatever, a lot of diseases. Okay, so some of the options of the treatment is removal of thyroid gland. Okay, so if we want to remove the thyroid gland, we need to ligate all these vessels: superior thyroid artery, which is coming from external carotid artery. Okay, the inferior thyroid artery, which is coming from subclavian artery, and sometimes we have a third branch which is coming here called thyroideum artery. Okay, it's coming from the subclavian. So we have thyroideum artery in 10% of population, inferior thyroid artery, and superior thyroid artery. We need to ligate these arteries. So sometimes, and by mistake, when the surgeons ligate the inferior thyroid arteries, they ligate as well the recurrent laryngeal nerve, and they cut this nerve. Unfortunately, if this nerve is damaged during surgery, it will lead to paralysis of some of the muscles of the larynx, leading to initially, like if it can be unilateral or bilateral. If it is unilateral, will lead to hoarseness of voice, and if it is bilateral, it will lead to uh, complete paralysis of the muscles of the larynx, and it will lead to difficulty and uh, inability to breathe because the air cannot cross the larynx and the vocal cords. Okay, so this is like clinical application related to the thyroid part gland. Sorry. And by so doing, we finish our session for today. Thank you so much for your attention, and see you in the next video.